Someone wanted to know about the crowded optic nerve head, and by crowded we mean you have a small cup to disc ratio, or there's something in the nerve that's making it cramped, and the most common is disc drusen. It clogs up the whole disc because it's full of rocks, calcified debris that we call disc drusen. So both the small cup to disc ratio and the disc drusen are what we call the structural disc at risk, and what you're at risk for is non-arteritic anterior ischemic optic neuropathy. So NAION is associated with a small cup to disc ratio and disc drusen because they both make it real tight space. And so if you have a nerve, it has a cup, and the cup is where the nerve fibers are bending and exiting and being displaced to the side. And so it's like a donut with a donut hole. So you can have a donut with a big hole, and the most common cause of this is glaucoma, or you can have a donut with no hole because it's a jelly-filled donut because it's filled up with disc drusen. So if you have a small cup to disc ratio, that is thought to be a predisposing risk factor for non-arteritic anterior ischemic optic neuropathy because it is a focal area of small vessel ischemia. But if it's inside a very tight scleral canal, that focal edema will lead to further compromise of the small vessels in the disc head and could cause spreading of the edema in the tight space, like a compartment syndrome. And that is one of the presumed hypotheses for non-arteritic anterior ischemic optic neuropathy that links the structural disc at risk to development of an ischemic event, which is completely counterintuitive. However, because we really don't know what causes non-arteritic anterior ischemic optic neuropathy, the possibility that it is mechanical and related to local compartment syndrome in the disc head is the presumptive mechanism by the small cup to disc ratio, including disc drusing, being a risk factor for NAION. And that disc we call the crowded disc.